Hi friends, welcome back to my channel. Friends, subject wise discussion is continuing and we completed one set of questions from Fundamentals of Nursing part 1. This is part 2 video. Here we can see the next set of questions. First question, first school of nursing was established by options. Option A, Florence Nightingale. Option B, Theodore Flenner. Option C, Virginia Henderson. Option D, none of this. Question, the first school of, who established the first school of nursing? That is the question. Correct answer is option B, Theodore Flenner, who established the first school of nursing. The next question, drug that cause the contraction of tissue and arrest secretion is called. Option A, antacids. Option B, antiseptics. Option C, astringent. Option D, anticoagulant. Correct answer is option C, astringent. Astringent are this drug that cause contraction of tissue and arrest the secretions. The second option, antacids. Okay, antacids are the substance that react with HCl or hydrochloric acid to decrease the activity of gastric secretions. They are known as antacid. And antiseptics are there. Antiseptics are the substance that inhibit the growth of bacteria. Anticoagulant, fourth option, anticoagulants are the substance that inhibit or decrease the blood clotting process. Okay, here correct answer is option C. The next question, why bath is not advised immediately after meal? Options, option A, it reduces heart rate. Option B, it increases respiration. Option C, it interferes with the process of digestion. Option D, all of this. Correct answer is option C, it interferes with the process of digestion. We should not give bath to a patient immediately after meals because it decreases the blood supply to the digestive organs and also it interferes with the digestion. So we are not advising bath immediately after meal. Okay, so here option C is the correct answer. The next question, disinfection of patient unit after the death or discharge of the patient is termed as. Options, option A, concurrent disinfection. Option B, terminal disinfection. Option C, sterilization. Option D, disinfection. Correct answer is option A, terminal disinfection. Terminal disinfection means the disinfection of patient unit with all articles, that is the patient used the mattress, linen, bedsheet, pillow, furniture, whatever the things used by the patient on his discharge, death or released from the isolation is known as terminal disinfection. Concurrent disinfection, first option, concurrent disinfection means disinfection of all the articles used by the patient during the course of disease, that is the patient is staying in the hospital, that time the disinfection is doing, that is known as concurrent disinfection. Terminal disinfection means after the discharge of the patient or after the isolation or after the death of the patient, the area or the patient area is cleaning, that is known as terminal disinfection. The next question, nursing care that is based on identifying and meeting the needs of the patient is called. Options, option A, client oriented care. Option B, prioritization. Option C, goal oriented care. Option D, none of this. Here correct answer will come option A, client oriented care. That means to identify the needs of the patient, the nurses is giving care. Okay, that is known as client oriented care. Option A is the correct answer. The next question, condition that increases the vulnerability to a disease are known as. Options, option A, etiology. Option B, precipitating factor. Option C, risk factor. Option D, pathophysiology. And the correct answer is option C, risk factors. Vulnerability means it is attacking more or it is affecting more. Okay, here the condition that increases the vulnerability to a disease is known as a risk factor. Move on to next question. Fever with relatively bradycardia are seen in option A malaria, option B typhoid, option C filariasis, option D dengue. Here question, fever along with bradycardia. Bradycardia means decreased heart rate, can seen in case of typhoid. Option B is the correct answer. Fever with bradycardia is seen in typhoid. The next question, at what time the ward census should be done? Options, option A daytime, option B morning shift, option C afternoon shift, and option D midnight. Ward census. Correct answer is option D, at midnight. Ward census means in a particular ward how many patients are occupied in the bed and how many remaining beds are there. Okay, so how many patients are there in bed and how many remaining beds are there, that is ward census. It can take at midnight. During morning and afternoon shift, mostly admission and discharge will be there, so we can't tell properly how many beds are remaining. Mostly it can take at midnight. Option D is the correct answer. The next question, in which of the following condition temperature is not taken by mouth? Option A client having convulsions, option C mouth breather, option D child under 6 years of age, and option D all of this. And the correct answer is option D, all of this. So the temperature which is not taken by mouth in case of client who is having convulsions or mouth breather or child under 6 years of age, we are not taking temperature by mouth. Here all of this is the correct answer. The next question, the range in the body temperature within which the cell can function effectively is. Options, option A 37 to 42 degrees Celsius, option B 34 to 41 degrees Celsius, option C 36 to 47 degrees Celsius, and option D all of this. Correct answer is option B 34 to 41 degrees Celsius. Move on to the next question. The body temperature remains between 100 to 103 degree Fahrenheit is called. Option A hyperaxia, option B hyperpyraxia, option C moderate pyrexia, and option D low pyrexia. Correct answer is option C moderate pyrexia. The temperature between 100 to 103 degree Fahrenheit is known as moderate pyrexia, or the in Celsius it is 37.8 to 39.4 degrees Celsius. High pyrexia means the temperature, first option, the temperature between 103 to 105 degree Fahrenheit, that is known as high pyrexia, and hyperpyrexia means above 105 degree Fahrenheit, and low pyrexia means it is between 99 to 100 degree Fahrenheit. In short, 99 to 100 degree Fahrenheit is low pyrexia, between 100 to 103 is moderate pyrexia, 103 to 105 it is high pyrexia, and above 105 it is hyperpyrexia. The next question, when a drug is to be given at tonight, which of the following coded instruction is used? Option A AC, option B HN, option C HS, option D SOS. Tonight means it is HN. Okay. First option AC. AC means after meals. Second option HN. HN means to night. And third option HS means at bedtime. SOS means if necessary. Okay. Option B is the correct answer here. The next question, appropriate size of rectal tube for giving in enema for infants is. Options, option A number 22 to 24, option B number 12, option C number 16, option D number 8 to 10. Appropriate size of rectal tube for giving enema of infant is number 12 French. Okay, various size we can see. For infant it is 10 to 12 French, for toddler it is 14 to 16, and school age 16 to 18 size, and adult it is 22 to 30. Infants 10 to 12, toddler 14 to 16, school age 16 to 18, adult 22 to 30. Next question, in ABJ analysis, which parameters are assessed? Options, option A sodium bicarbonate and pH, option B sodium bicarbonate, carbon dioxide, oxygen and pH, option C sodium bicarbonate, oxygen and pH, option D carbon dioxide, oxygen and pH. The parameters of ABJ analysis is option B sodium bicarbonate, carbon dioxide, oxygen and pH. The normal values of ABJ analysis include pH, partial pressure of oxygen, partial pressure of carbon dioxide and bicarbonate. Normal pH is 7.35 to 7.45, and in partial pressure of oxygen normal is 80 to 100 mm of Hg, and the partial pressure of carbon dioxide normal is 35 to 45 mm of Hg, and bicarbonate is 22 to 27 milli equivalent per liter. This is the normal ABJ value. Move on to the next question. Osmotic pressure and acid-base balance of the body fluid are maintained by options. Option A fluoride, option B sodium, option C chloride, option D zinc. And the correct answer is option B sodium. Osmotic pressure and acid-base balance of the body is maintained by sodium. Next question, in which one of the following condition NG tube is contraindicated? NG tube means nasogastric tube is contraindicated. Option A hypertension, option B diabetes mellitus, option C esophageal varices, and option D severe dehydration. And the correct answer is option C esophageal varices. In esophageal varices, usually not advising this NG tube feeding because due to the dilated esophageal vein, there is a chance of a rupture will occur if we are inserting this NG tube or Ryle's tube to the patient. So usually it is contraindicated in case of esophageal varices. Option C is the correct answer. The next question, RBC can stored up to options. Option A 35 days, option B 40 days, option C 42 days, and option D 50 days. An RBC can stored up to 42 days. Option C is the correct answer. This packed RBC can stored at a temperature of 2 to 6 degrees Celsius for about 42 days, and one packed RBC consists of about 250 ml. Next question, in gangrenous condition of the lungs, the sputum will be dash in color. Option A red color, option B green color, option C brown color, and option D black color. In a gangrenous condition, the sputum will be brown in color. Option C is the correct answer. A gangrenous condition means the tissue death occurs in the lungs due to decreased oxygen supply. In that case, the sputum will be in brown color. The next question, which poison can able to form a strong bond with hemoglobin and can cause functional anemia? Options, option A organophosphorus poisoning, option B carbon monoxide poisoning, option C arsenic poisoning, and option D all of this. Here correct answer is option B carbon monoxide poisoning. The next question, storage temperature of platelet is options. Option A 2 to 6 degrees Celsius, option B 20 degrees Celsius, option C 22 degrees Celsius, and option D minus 22 degrees Celsius. Correct answer is option C, 22 degrees Celsius. The platelet can stored at room temperature or it can stored at a temperature of 22 degrees Celsius. This platelet can stored up to 5 days at a temperature of 22 degrees Celsius, okay, or room temperature, and a packed platelet consists of 50 to 60 ml. Okay, this is also important point, 50 to 60 ml. The next question, maximum oxygen delivered to the patient by which method? Options, option A by oxygen tent, option B by nasal cannula, option C by non-rebreather mask, and option D by mask method. Correct answer is option C by non-rebreather mask. Maximum oxygen delivered to the patient by using non-rebreather mask. A non-rebreather mask can deliver 60 to 100% of oxygen, and partial rebreathable mask can deliver 70 to 90% of oxygen. And a Venturi mask can deliver about 24 to 55% of oxygen. The next question, which concentration of oxygen causes toxicity to patient? This is an previous year question. Option A 40%, option B 60%, option C 90%, and option D 70%. Here correct answer is option C 90%. Toxicity by 90%. Move on to the next question. How often a donor can give blood? Options, option A every month, option B every 2 months, option C every 3 months, option D every 6 months. And the correct answer is option C every 3 months. The donor can donate blood within every 3 months, and while giving the blood they should be physically healthy and should not have any diseases, mainly heart, kidney, lungs, liver disease, that you should not have any diseases, and the age should be between 18 to 65 years. If the donor is a woman, then she should not be pregnant within the last 6 months. And normally the hemoglobin level must be above 12 gram per 100 ml. These are all some criteria for giving or donating blood. Move on to the next question. 1 unit of blood contain how much amount of blood? Options, option A 250 ml, option B 350 ml, option C 450 ml, and option D 500 ml. 1 unit blood contain 350 ml. Option B is the correct answer. Usually this whole blood contain 350 ml, and this whole blood can stored up to 35 days at a temperature of 2 to 6 degrees Celsius. This is an important point. The next question, milky white color of urine is due to the presence of option A TB, option B filariasis, option C malaria, option D cholera. Milky white color of urine is due to the presence of filariasis. Milky white color of urine is known as chyluria. Chyluria is due to the presence of filariasis. Another important point, if the urine is smoky brown means there is a presence of blood pigments. If it is reddish brown means there is a chance of urobilinogen. If it is green or brownish yellow color means it indicate bile salt and bile pigments. Okay, smoky brown means blood pigments, greenish or brownish yellow means bile salt and bile pigment. Reddish brown means urobilinogen.